go with our own slide that really emphasizes social media. So you'll note here that we've got our Twitter handles that clearly kind of link who we are and the hashtag on our slide. So please feel free to use Twitter or other forms of social media to share your thoughts and expand the conversation and echo what you hear from my colleagues here. So this is a kind of an exciting moment and place to be for me. I'm an East Coaster. I'm from Washington, D.C., and I've never been to Digital Hollywood before. I've really only been in LA in the airport, quite honestly. So it's really exciting to come to this conference and see this convergence of folks who work in the entertainment industry and technology, which Digital Hollywood has been about for years, and to see that they're taking on the topic of health and healthcare for the very first time this year. I don't know how many of you are veterans of this conference, but this is a new thing. And I think the folks who run the conference, particularly Victor Harwood, really understands that over time, there's going to be much more confluence between these different areas. And there are numerous ways in which I think the three come together. Can we go back to that slide and just keep it on? Awesome. Thanks. Oh, okay. Great. Thank you for helping it not do it. Excellent. So I think there are a couple of ways in which media and social media interact with health and technology. One is, as I've heard from the last day or so of listening to other sessions in this track, obviously celebrities, movie stars, personnel who write books or are famous because of their blogging or other things have a huge influence on how we think about health and a lot of our health actions as individuals. But also from the technology standpoint, there's this amazing explosion of gadgets and apps, tens of thousands of apps on our phones and wearables and other kinds of devices and technologies that are generating more information and allowing us to be more social too about our health and connect with one another, regardless of the celebrity loop. So there's a lot of opportunities for cross-fertilization here. And what we're going to do is we're going to talk about sort of opportunities from these various perspectives and how we think about this world and what are the opportunities from the particular places from which we sit. The way we're going to organize this is we're going to go through and do some brief introductions, then we'll have some discussion among the panelists, and then open to the floor for questions. Everybody here is going to introduce themselves, but as a sort of a quick, maybe a Cliff's Notes version, part of why I chose them was not only because I thought they were each individually really interesting, but basically Russ from ShareCare represents health content through a really, a channel that has a mass audience, but coming from the perspective of a digital health company. Amy is both a patient herself and also a publisher. So she's somebody who uses, especially social media, a great deal on a daily basis and brings to this work a real patient perspective from the diabetes community in particular. Sheila is a researcher who can help us understand what's going on in this area and particularly shed some light on behavior change, which is really what a critical aspect of the coming together of these worlds. Much of health and healthcare is about what we do and the choices we make as individuals. So understanding that's really important. And Doug from Under Armour is from a company that started off making t-shirts, but really is in the sports apparel world converging into this broader health and healthcare world. Again, my background is I've been in the consumer engagement space for about 10 or 15 years. Most recently working in the federal government, I headed up an office within the Department of Health and Human Services at HHS, where we were trying to shape policies. There are billions of dollars going through a program called something Meaningful Use is what it's called. And I know at least one person has heard of it. And what it's trying to do is get doctors and hospitals to adopt electronic health records. And in that process, what I pushed for was, well, while that's happening, let's make sure that patients and consumers are part of the loop. We're getting our own information, not only able to get our health records, but also to contribute information back in and have more of a conversation with the health system. So that's a little bit of background on me. Russ, do you want to start us off?
Sure. Thanks, Lygia. I'm Russ Johannesson. I'm with ShareCare. As Lygia mentioned, ShareCare is a health and wellness engagement platform for consumers. We are a digital health company. We are heavy into both the the tools and the engagement aspects of it through social media and through web and other technology platforms. The company was founded in 2010 by Jeff Arnold, who was the founder of WebMD, and Dr. Mehmet Oz, who at the time was a occasional or frequent guest on the Oprah Winfrey Show before he had his show on television. And we can avoid going down that whole conversation stream at the moment if you want, or we can go into it. I don't care either way. The company has a consumer presence, sharecare.com. Consumers can go there and get equipped to be better consumers of their health. As Lygia mentioned, we have tons of health-related content in a variety of different formats, but most importantly, we have tools and a personalized dynamic profile for consumers to store and track and engage in their health information in a meaningful way. And the most important part of our platform is to be able to connect those consumers with the information and the resources they need, but then also connect them into the healthcare system, because at the end of the day, it's not about self-care. It's about connecting them in a smart way into the right portions of the delivery system to kind of make that work. We have about 87 million registered users. We get about 950,000 new members a month who come through. Our task is to engage them in meaningful ways. We do that through a couple of different kind of key principles. One is a term we use, ultra personalization. We feel like health is such a specific topic that it's really only relevant to me if it's highly personalized to who I am and what my interests are and what my health needs are. And then interoperability is the other word I would throw out there, is the ability to use all of that amazing data that I'm sure we'll have a lot of conversation about to power a lot of different tools and solutions that can help people not just understand and improve their health literacy, but actually engage in the kinds of interventions and behavior change that lead them to productive, positive changes in their health. It's kind of what we're at. We take that consumer platform that we've built up over the last few years, and we also white label that technology solution for other sponsors of care who are trying to manage the health of their population. For example, the Department of Defense, every soldier in the U.S. Army uses a version of our platform. They come in, they take a health risk assessment, they get experts and content recommended to them to follow. There are tools and solutions in there to help them improve their health and wellness that are specific and related to the things that the Army wants to push, which are things around readiness for deployment and resiliency and those types of things. We have other customers of our platform that use it in slightly different ways. Large hospital systems, HCA, the largest not-for-profit or the largest for-profit hospital system in the country. Hospital systems like Trinity Health, one of the largest not-for-profit, use our tools and platform as a patient engagement platform. So once patients come through their system, they want to continue to be in a dialogue with them and engage them with that kind of content, et cetera. We use it for corporate wellness programs. We use it for other types of sponsors of care, almost in a population health management way, whether it's AARP trying to serve the more 50 plus population, whether it's, frankly, we've worked and talked with church groups who are trying to manage the health of that population, the church-going population. So a variety of different ways to do that. For us, at the core of it, it's about using data, specific data on an individual to drive that personalization that I talked about. We think the engagement aspects around health are all around being relevant to that consumer and giving them the right information at the right time to be able to make the right kinds of decisions, and that requires data. We get that data in a variety of ways. We always start people off with a health risk assessment. You may have heard of the Real Age test. We acquired the Real Age company a few years back.
Has anyone done that? I'm just curious.
Real Age test?
I have.
Yeah. There you go.
Anyone?
All right. Well, you're in good company. Over 40 million people have taken that assessment. We have a database of about 5 billion health facts around people who have taken that test. To the extent that those people, or you all, have opted in to be in a dialogue with us on that information, we now can open that dialogue, understanding your health interests, your conditions that you're trying to manage, et cetera. And we use that information to serve up this highly kind of personalized experience to you. We also keep other types of information, whether it's your medical records to store in your profile, whether it's your health tracker information, whether it's your lab imaging results, those kinds of things. Our view is that it's important for consumers, and I think this will be a somewhat consistent view across the panel, that consumers have an increasing interest almost responsibility and obligation, and hopefully increasing opportunity to own and manage their own health data and manage their own health in that process. And we are trying to create what I would suggest is more like if Amazon kind of owns your retail profile and that they know about your shopping habits online to the extent that over time, they're shipping product to the distribution center in your neighborhood before you even know you want to buy it, because they know that people like you tend to buy these kinds of things. Or LinkedIn manages your business profile, or Mint, if you're a mint.com user, manages your financial profile. We want ShareCare. We're building ShareCare to be your health profile, that place where you can have all of that information in one place, all of that content that's contributed by leading experts and organizations kind of across the healthcare spectrum. We sort of talk about it as aggregating the collective IQ of health in one place, and then using that to equip people to make great decisions based on their information and what they're trying to accomplish with their health. So in addition to that, we sort of run Dr. Oz's digital presence and his social media presence, so droz.com, as well as his social media presence. And as Lygia mentioned, we don't control the show or the programming in the show, but we do use that mass media outlet and that celebrity voice to drive very broad kind of healthcare kind of messages with the intent to drive people to very specific, actionable information in the ShareCare environment. So it's kind of that mix. And I guess of the folks on the panel, maybe our company sits a little more in that sweet spot between media and health as we look through that. So I'll be quiet.
All right, Amy, you want to jump in? You've been in that sweet spot for a while.
Yeah,
that media
absolutely.
Health
Media and health, that's me. So I hope that you all have heard or are excited about this so-called e-patient revolution. And I'm proud to say that I'm sort of one of the pioneers in that. So I have a background in journalism, in technology journalism in particular in Silicon Valley, and was diagnosed myself with type 1 diabetes in 2003 and felt like I was pretty much the only adult on the planet who would ever get this juvenile disease. So it was very life-changing. And I think the most eye-opening thing for me, and remember, this is 2003, so there was no such thing as social media. So trying to just the experience of being a person who's now living with compromised health, I'm thinking I am an educated person. I have financial resources. Able to have access to things, and I'm still struggling like there's no tomorrow. So if this is difficult for me, it's got to be difficult for the millions of other people out there with diabetes and other conditions. And I think one of the big things we're talking about the consumer relationship here is that once you become a patient and you are, within the healthcare system, you're not really considered, or traditionally haven't been considered, a consumer. It's not a consumer, like a customer relationship. It's more like you're this patient that things are going to be done to you. You are the sort of the recipient of engagement as opposed to the other way around. And the work that I have done is really to turn that patient engagement notion on its head so that we as activated people living with these illnesses can actually have a voice and stand up and talk about what we need and be more involved in the decision-making processes that affect us. So this started out really small. When blogging software appeared on the scene, I decided to start a blog. My husband actually who's in the back, encouraged me to do so. And I thought, who's going to want to read about, living with diabetes? Well, it turns out a lot of people do. And because they're really desperately looking for other individuals walking in their shoes. And we have a lot to learn from each other. And we actually, through social media, as it's developed over the last 10 years, now have this collective voice that we never had before as patients. And we're able to accomplish great things with grassroots online advocacy. So beyond the blog itself, which, by the way, has become successful on its own, it's now a sort of a well-known networking and information resource for people, not only people.
Diabetesmind.com.
Diabetesmind.com,
yeah.
Correct. It's not only for people living with the illness, but also for caregivers, and a lot of people in the pharma industry read us because we write a lot about our views of products and technology and care. And so it is, we call it a diabetes newspaper with a personal twist. It's written all by and for people who are living with this condition. And we try to kind of look behind the headlines. As you all know, you see bajillions of headlines every day, often contradicting themselves about diseases like diabetes and other things. What causes it? What prevents it? Who knows? It's very confusing. So we try to help people wade through all of that. And the blog actually now, as of January, is part of Healthline, which is a somewhat competitor to ShareCare, a health media site and organization that has about 25 million visitors a month and has information about a number of different health conditions. The company also has a sort of a health IT analyzation side. So there's two sides of the company, the media organization, and then the side that works on platforms and health data. And they have big customers like IBM and Aetna, where they're helping create platforms for also integration with EHRs and whatnot. But in addition to being a publisher, I'm also an advocate. So I penned this open letter to Steve Jobs back in 2007, which was really just this kind of tongue-in-cheek post calling for better design of devices for people with illnesses, obviously in particular diabetes, and saying, we have these incredible devices that are coming out now for, little machines to listen to music on, and they're so colorful and personalizable. And we have this sort of hospital looking crap for, living with diabetes. And you have to remember, you're carrying this stuff around 24/7. In a lot of cases, it's attached to your body, and it needed to be designed more with life in mind. So I kind of made a big play for that, and that post got picked up in TechCrunch, and then it kind of ricocheted around media and helped me start this whole national campaign around improved design of medical devices. And then we launched an open innovation competition in 2008 called the Diabetes Mind Design Challenge that we ran for 4 years. And it was a blog-based, patient-run, basically push for better tools. We asked people to submit their ideas, any ideas they had for something that would improve life with diabetes. Some innovation, didn't have to necessarily be a piece of technology. So we got everything from like board games to teach people to, some very high-tech things, but also just some designs that would be more appealing to children, just really exciting stuff. And after having done that for 4 years, we sort of decided that the next big step would be, how can we actually, break down these walls? Everyone's always talking about silos. You've got the pharma industry, which is very legacy, very risk averse, thinks in terms of clinicians being their customers as opposed to actual people out in the world who are wearing these devices or using their drugs. And then, I, again, have a connection to Silicon Valley. So you have all of these developers who are creating this incredible technology. They're all about user interface, but they don't necessarily understand patients' needs in real life or even understand what they're up against with the whole healthcare establishment. And then, of course, patients trying to have a voice. So basically, we decided to create a summit, an innovation summit that would bring these people together, regulators, the pharma and device companies, the clinicians who are really forward thinking about having patients be more active in their own care, the designers. So I worked with IDEO Design actually on the competition. So they were involved. And we started this thing at Stanford School of Medicine about 4 years ago. We've been running this innovation summit ever since. And I'm also very involved on the data side, data interoperability, device interoperability, data sharing, because that's a huge problem in the medical world. Sort of like the computer industry years back when everybody had a different cable and nothing plugged into each other, was all proprietary, and it was so frustrating. We're still experiencing that in the world of diabetes data, which is crazy because we could make use of this data in such good ways for our care if we had better access to it and if the devices were more interoperable. So we sort of ended up kicking off this campaign called #WeAreNotWaiting, which is really this notion, and enabled through social media. Patients, tinkerers, there are a bunch of dads out there who have, for example, children with type 1 who've just taken the technology, reverse engineered the protocols, and started to create these apps and devices and solutions. They're not waiting for the regulators. They're not waiting for the pharma industry to decide to do it. So it's a very exciting time. And as I said, I'm just honored to be part of it. And, it's fun and it's meaningful. And I think, it's really important to think about the fact that so many people, thankfully, are living well and actively with conditions now, health conditions that they need help with, but they're no longer just laid up in a hospital. They're out there having active lives, and we're trying to, bring those people together. So again, we have a collective voice to represent our needs.
Cool. So Amy, I think your letter to Steve Jobs must have been passed around internally or something, because it took a little while, but Apple's doing something called Health Kit now. Research Kit, not to mention a lot of health functions on the Apple Watch. So, okay, Sheila.
Hi, I'm a faculty member at the Annenberg School for Communication and Journalism at University of Southern California. And for the last 20 years or so, I've been studying why people do what they do. My training is actually a social psychologist. And And for the last 10 years or so, I've really become passionate about the use of narrative or stories in trying to change people's behaviors. And I've worked internationally with the BBC. In India, we have a project on human trafficking in Indonesia with MTV. And in the US, we try to work with popular television shows to try to encourage them to integrate accurate healthcare information. However, the one thing that's been just stuck in my craw for the last 10 years is the fact that the US government absolutely refuses to use narrative in a widespread type of way. They insist on producing these really dreadful manuals for people with whatever disease it is. And they are essentially the same manuals they've been producing for the last 20 years. And so what I did is I actually asked the head of the National Institute of Health, Francis Collins, I said, you know, what would it take? And he said, well, we're uncomfortable unless there's been a large scale clinical trial of the same information presented in a narrative or story format and the exact same information presented in a non-narrative format, the exact same information, and then tested to see whether narratives actually could perform better than non-narratives. And so that's what I've been spending my last 5 years on. And I just wanted to show you, we're going to show you
Can we run Sheila's
a
sizzle
little
reel?
clip. So yeah.
Okay.
See what happens when I hit play. Your screen is split.
I'm Sheila Murphy. In
My screen is split?
transformative our
Pardon me.
Your screen, you see the piece.
What? You know what? I think what we might do,
Okay, it's behind.
I think we've got it. It's that
back there.
yellow.
It's-
Yeah,
yeah.
excellent. Perfect. I don't think the volume's up, so we might want to
Right.
do that too. Awesome.
R1 application, Lourdes Baez-Conde Garbinati and I asked two questions. The first was, what caused Pinocchio's nose to grow? And the second was, what was the name of your second grade teacher? If the answer to the first question came to you faster and more easily than the answer to the second, you're not alone. The power and perseverance of stories or narrative have been recognized and utilized for thousands of years. Yet when it comes time to craft health messages designed to convey potentially life-saving information, Western medicine all but ignores the use of narrative. From the standpoint of government agencies like NCI, they're just being prudent. After all, there's never been a tightly controlled experiment or clinical trial that presented the identical information in both a narrative or story-based format and the more traditional non-narrative format and compared their impact on the target audience. Our TR01 did exactly that, as well as identifying the conditions under which narrative may be more or less effective. We developed two short films that contained the same facts regarding cervical cancer prevention, detection, and treatment. But the narrative film, Tamale Lesson, embeds these facts into a story about the Romero family's preparations for their youngest daughter's birthday.
Okay, when you go to the doctor, you sit on the table and they spread your legs like this.
Oh, stop. And what exactly does the doctor do?
Okay, so let's pretend this is your vagina.
It's not that color.
Petra, just pretend.
Okay, I'm a tamal.
So the doctor has like this device, this metal device. They just spread the walls of your vagina.
I don't say words like that.
Petra, you never had this test done before? It's not as bad as it looks. Mira. They take this mascara type wand and then they just rub you on the inside like that.
The non-narrative film, It's Time, takes a more traditional approach by featuring doctors, patients, and graphics. Using a random digit dial procedure, we selected and surveyed 300 European American, 300 Mexican American, and 300 African American women to establish their pretest or baseline level of cervical cancer-related knowledge, attitudes, and behavior. We then randomly assigned them to receive either the narrative or non-narrative film, and then resurveyed them 2 weeks and then 6 months later. Looking at the gray segments of each bar, you can see that at pretest, before our participants had seen either film, a significantly higher percentage of European American women had been screened within the past 6 months compared to our African American participants and Mexican American participants. This suggests that an ethnic disparity in cervical cancer screening existed in our sample at pretest, not unlike the ethnic differences that exist in the general population. The blue segment of each bar represents the increase in screening within the 6-month window after seeing one of our 2 films. While both films increased screening, the narrative was more effective than the non-narrative in doing so. In fact, the ethnic disparity that we saw at pretest is virtually erased at 6 months for the Mexican American and African American women. We're not suggesting that it is ethnicity per se that underlies these effects, but rather the extent to which an individual identifies with the characters or becomes immersed in a story that matters. Although this research focuses on cervical cancer, these results have implications for virtually all healthcare communication.
Thanks.
I just wanted to underscore, 2 points off that. One is, in the excitement over, as Lygia calls, the explosion of gadgets, don't sort of overlook the importance of content. And it's not just any story, it's stories that people became transported or engrossed in, right? It has to be a good story. And characters that they identify with. You'll notice that deliberately we made that film have a very Latino flavor. That was deliberate because we anticipated that the Mexican American women in our sample would identify more with those characters. And to the extent you identify with the characters, you're more likely to follow the behavioral instructions, which is what we saw. So again, just remember the content, and also remember that you can't just take content from platform to platform, that you really have to tailor it to different platforms. Obviously online has to be shorter, sharper, and things like that. So.
Did you take your results to the?
Yes, in fact, this 2-minute video actually won the NIH's award for best explanation of federal grant money. And so Francis Collins himself, the man who I initially started off with, had to stand on a podium and give me an award while the chicken was playing right behind him. So I got my own back. So thank you.
I wish I was in Russ's seat. Now I have to follow up the chicken video. Not fair. I drew the short straw. My name is Doug Zywatz, head of digital media and advertising for Under Armour Connected Fitness. And Under Armour Connected Fitness is a group underneath the umbrella of the Under Armour brand. And for those of you who aren't familiar with Under Armour, we're a leading global sports and apparel company that is roughly over $3 billion in yearly revenue, founded in 1996 by Kevin Plank. And we were the company that redefined the T-shirt. Our heritage is in the athletic space. Our culture and image heritage is around the bloody knuckled football player imagery. And the founding father, Kevin, simply sought out to solve a problem, and the problem that he was trying to solve was of having he originally had a cotton T-shirt that they were wearing under their football pads, and it was becoming soaked with sweat over the course of the game, and didn't wick, and it was heavy, and it was obviously affecting temperature, and so he invented a T-shirt, and from there, grew the brand Under Armour. But what's interesting about what we're doing today and my path to Under Armour was through a company called Map My Fitness. And Map My Fitness was founded in 2007. And Map My Fitness's motivation was to empower users through the use of technology to record, track, and share their workouts. And it was about collecting data and information and informing what it was you were doing in terms of your activities. Do we have any Map My Fitness users here in the crowd? We got one. Any Endomondo and or MyFitnessPal users? nutrition and health tracking. I'll get to those guys in a second. But in 2007, as I said, we set out to empower users, giving them technology so they could track their workouts, and ultimately got acquired by Under Armour. But more recently, Under Armour went after two more companies, one of which was Endomondo, which is the European equivalent of MapMyFitness. They have a big global footprint, and their goal really was very similar to MapMyFitness, which is about giving users the tools to be able to record, track, and share their workouts as well. And then MyFitnessPal is another company that we acquired recently, which is I would say the hallmark platform for nutrition and health tracking. And really what we're trying to do as a company, we realized that there was a big opportunity to serve our consumers in a unique way. And what that meant is acting as the central hub for all of their health and fitness information. And doing so through the use of technology. And one of the things that defines us different than most companies or most fitness tracking platforms is we are a self-described open platform. So that means that with the advent and the massive growth of wearables and tracking technology, we're providing a centralized location for users to share all this information. And I heard Russ talk a lot about what they're doing at ShareCare, and it sounds very, very similar to what we're doing in terms of achieving and serving the consumer, and we're tracking towards the same goal. But I believe that we're really approaching it from a different end of the spectrum in terms of, or the wellness spectrum, as you want to think about it. Our heritage is in fitness tracking and wellness, and that's where we've been able to build our platform from. And so currently we have about 137 million connected users globally, and our goal is to build that platform to 500 million connected users. And we're actually acquiring about 5,000 new users every hour. So the opportunity is massive, and the levels of engagement that we're able to establish with our user base are really, really powerful, really, really amazing. And we think that there's a big opportunity to own and take the lead in the space, similar to what ShareCare's mission is. Nobody today, I would argue, whether it's coming from the clinical side or the fitness and wellness side, there's no clear leader. There's no centralization for this information, and consumers want it. They want to be empowered by it. They want to be able to use it to inform them, to serve as an advisor for making informed decisions. And I think what's interesting about where we are in this day and age, and this particularly in a very nascent industry, we've been focused on data collection for so many years, and we've been focused on better wearables, better devices, being able to record information in a more seamless fashion. And our goal at Under Armour is to get to a point where recording this type of information is as simple as putting on a t-shirt. That's really our vision down the road. But what we've yet to, I think, establish in the place that I think where the user experience gets truly rich for the consumer is now putting authoritative content and guidance and experts in place to be able to translate what they're doing into meaningful and actionable outcomes. So more of a predictive modeling type of situation down the road. And I think if we get to that place, all of us here are going to benefit from that. In enabling our missions of serving the consumer, because now they've got all this information at their fingertips, which they didn't have before. And our CEO Kevin, likes to use this analogy a lot when he talks about Under Armour moving into the technology space. And make no mistake about it, yes, our heritage is in apparel and footwear, but we view ourselves as a technology company, and we view ourselves in that situation, in that position, because eventually this is going to consolidate. Technology, apparel, footwear, it's all coming together. The convergence is happening, and so we believe that somebody who's a pioneer in apparel and footwear absolutely has just as much chance of creating a really valuable product for the consumer as the companies in Silicon Valley. So why not us put technology into apparel and footwear versus Silicon Valley trying to figure out apparel and footwear and integrating the technology? That's the path that we're following. So one, that absolutely is a goal of ours. But secondly, there is a big open gap in the ownership of health and fitness technology. And the analogy is like when you go to the doctor, I mean, literally today, they still have the manila envelope, when you walk into the doctor's office, and that's where your information sits. But, conversely, when we think about our automobiles, or we think about our iPhones, or we think about all these other tools that we're using from a consumer perspective, we know much more about them than we do our own bodies. And we can share that information more easily than we can the information about our own bodies. So we're trying to solve that problem. And, we're looking at it through the lens of athletics, which we think are synonymous with things like performance, getting better, goal achievement. Our brand slogans are, our mission is all about empowering athletes every day through passion, design, the relentless pursuit of innovation. And our vision is to make all athletes better. And so we believe that everybody in their own right, whether they're in a clinical state and they're trying to manage a specific disease, or they're just trying to be more transformative in terms of their health and wellness and their behaviors, look good, feel good, do better, do more. That's where we think we're providing value into the equation.
Awesome. So each of you and the organizations that you represent, or individually or both, are working to engage people, consumers, patients, individuals in the context of health with slightly different goals, but ultimately toward better health. In this world of 24/7, always on media, how do you even get on somebody's radar? How do you think about getting their attention? And also, obviously, it goes beyond that. So it's get the attention, and then what do you do to keep it? What are some ways that you think about that? Like how do you even get the story in front of them, Sheila? Not to pick on you. Anyone who wants to jump in, feel free.
Yeah, market segmentation has become, obviously an issue. It used to be the case that we could ask a medical show, for example, ER, to put on a story, and at the time that ER was the popular health show, some of you remember ER, emergency room, then 1 out of every 3 families that had their television on was watching ER. I mean, that was a huge swath of the American public. Now it's become, the legacy networks, as they're now called, are getting a smaller and smaller and smaller piece of the pie. And so it's really has become a game of segmentation. So it's much harder to get eyeballs, as they say in the business. It's much harder to get a large sample. That said, you can get a much more targeted sample, right? For example, we know that people who are sitting home watching soap operas in the afternoon tend to be particularly resistant to to exercise, and so we know that they have certain health problems in common, often, not all, but often. And so in some ways, the fact that it's much more segmented could be an advantage that I think we don't take enough advantage of. Again, here in the US, it's a for-profit system of entertainment. And so as opposed to other countries where the government owns the cable channels or owns the broadcast channels. And here we kind of have to go hat in hand to the entertainment producers to try to get even accurate information. Never mind, certainly not a whole show on it, but maybe, if you're going to have diabetes, could you have the accurate symptoms?
Except that, I mean, you were talking about doing a lot of work for the NIH and like the CDC. So the government does own or control some portion of the messaging that goes out, but probably
on their website, right.
It's very small,
Yes,
relatively speaking,
yes.
and it's mostly not through, I'm not going to say digital media because there's a lot online, but there's not a lot in terms of either TV and 3 hours of educational TV is required per week, I think.
Of the
via
FCC, and that's really loose. What they consider educational is very squishy.
We think about engagement a little bit differently, and segmentation even a little bit differently, I guess. If you think about the spectrum, and I think Doug hit on it a little bit there, of health in general, from the wellness, fitness end of the spectrum all the way through I have an episode of care. Something happens when I need treatment right away, but it's acute, to managing a chronic condition and living with a chronic condition. That's a pretty wide spectrum, and any individual's needs throughout that process vary widely, and each of us come sometimes in and out of those different phases at different times. So it is all about understanding the consumer and meeting them where they are at that point in the journey and understanding what they're trying to accomplish at that time. So a consumer at 3 p.m. in the afternoon watching a television show is a different healthcare consumer at 3 a.m. when there's some health issue that's raised, so it's kind of when, where, how, what they're trying to accomplish and what they're trying to get done. And understanding that is difficult. And part of that pulls back to understanding the channels. If you just look at the trajectory of traditional media, I mean, television, print, even digital are on the decline, when actually really mobile consumption of all that stuff is the one that's on the rise. So we look at it and say, the future in a lot of ways is kind of here in mobile, right? It's not just the consumption of the content, but it's the thing that is with me all the time, and it is now the thing that is got so many what we would consider frictionless sensors in it that are tracking information all the time. Now my accelerometer is here. I totally get the idea that moving from kind of wearable devices to less, more frictionless things like just put the shirt on. But I think ultimately it's like, I don't need any device at all. The way I think we'll get more accurate, better, actionable data on individuals is to get to that frictionless world. And we're doing things like we acquired a company out of Germany that does voice technology. It can understand your stress by the fractal patterns in your voice. Okay, how about that? We're doing a trial right now where we've got employees of Coca-Cola, viewers of Univision to get that audience, hospital system employees, this really interesting group of different populations participating in a clinical trial where you just turn the app on in the background and do your normal everyday calls, and it will measure your mindset, your stress, the type of stress you have, and give you feedback on each one of those calls.
Can it do that for the person on the other end too?
No, it doesn't. I mean, but it does it for you on your end,
That's
right?
really intense.
And it doesn't. It just samples your voice patterns to get that stress. But the point is, you don't have to enter any data. I don't have to remember to put my device on. I don't have to do any of that stuff. It is running in the background and collecting information and giving me real-time feedback. And then I can look and see how it trends out over time. We think that's really kind of where that goes, and that's how you engage, because the key to, I think, getting change in health behaviors is to hit people at the point that they are making those decisions, whether they're good food decisions, whether they're good activity decisions, whether they're making good medical decisions or choices. You've got to kind of be available to them at the point in time with the information that they need in a relevant way. And that's how we look at engagement, is hitting people that way.
Yeah, I mean, there's no question. It's our platform, of course, I'm on the media side of the business. So we talk about right message, right time, right audience. And the vehicles, I mean, absolutely mobile right now is king for a couple of reasons that Russ mentioned, that everybody's got a device, and the proliferation of mobile devices and smartphones in particular are skyrocketing. That's not going anywhere. And I think even with the the explosion of the wearables, there's still limitations. There's no screen. Whether maybe it's an audio message that can be delivered, that may be a way of utilizing those in the short term, but very little space, very little screen space to deliver some sort of message to the user. And we've found a couple different things. Mobile obviously is a big way of connecting with our users, and going back to the philosophy of right time, right message, right audience. We're talking about workouts. We're talking about logging of nutrition and those types of things. So we have an opportunity when the user is receptive, post-exercise, pre-exercise, post-logging of some sort of nutrition product, to have a conversation and interact with them. Because you got to remember, in this day and age, we're talking about a very noisy space and all kinds of different media outlets. We've got, TV, we've got, email, traditional news, et cetera, But we have to understand that users are investing a portion of, I mean, we're fighting for attention. We're fighting for seconds. We're fighting for minutes. But the beauty of what we do, we feel like, is that people who are engaging in healthy behaviors are already investing that part of their day. We don't have to fight for that attention. We just have to learn how to talk to them effectively and engage them properly. So if most people are, hopefully, most Americans probably aren't, but sleeping 8 hours a day, working the other 8 hours a day, and work constitutes playing on Facebook these days for some. But then you've got, another 8 hours that are available for them to do whatever it is, personal time, which involves family and kids and shopping, right? You start breaking out the 24 hours and it's like, wow, we're all fighting for a sliver of their attention. So we got to be smart with it, and we got to be really effective in what we want to communicate and when and how. And we need to be where they are. We need to be where they're already out there, so we don't have to try to draw them in. And I was having a conversation with a big brand marketer once, and really traditional brand that is used to doing big time TV spends and, talking to people at home, watching daytime soap operas. And his comment to me was eye-opeking. And it's not something that's going to be, it's obvious to all of us here, but when you actually try to wrap your hands around it and perceive it, he said, if my users aren't sitting at home on their couch in front of their TV, or my consumers, I'm not talking to them, because we're doing so many other things these days and we're sitting there with our phones in our hand. And it was his endorsement for the idea that they need to adopt quickly spending into mobile or being in social. And another interesting piece of data that I can share that is that we focus on a lot at Under Armour Connected Fitness is the idea that we think workouts are the proxy for everything. This is a big data point for us. So where I'm going is influence. Influence is really, really key. So we've noticed, and we have the data that supports this, and you guys would probably all nod your head and say, yes, I would think this would be the case, but it's true, is the people who have the most friends work out the most, and the people who work out the most have the most friends, right? So social influence is key. So we're here talking about 24/7 consumer relationships. Two biggest things in my mind are mobile and social, and I think these are going to be the channels above all that we have to get really, really good at for us to achieve our outcomes collectively when it's all about modifying health behavior. Because the two challenges for all of us here are adoption and compliance, right? That's it. I don't care what you're doing, whether it's managing a disease or just trying to get better. Adoption and compliance is the holy grail.
So can I jump off your comment about basically, and Amy, you look like you had something to say, so I'll get back to you in a second. I bet you do. But I'm just curious too, and maybe this is something you can wrap into what you're saying too, and it probably applies more to Amy than to some of you others. What do you do? Like you talked about the importance of peer influence and connecting people to each other. What do you do when there's misinformation? How do you handle that? Do you get involved? That must happen on your blog all the time.
Oh, yeah.
What do you do with that?
Just another panel, the American Journal of Managed Care, all the providers, it's oh my God, Dr. Google, people are going to be spreading this terrible misinformation. Right. Everyone's it's so frustrating. First of all, in this day and age, there are many ways to tell the credibility of a website pretty quickly. There are voluntary accreditations. There's the ON code, Health on the Net code, which is the main accreditation to show that these sites have been peer reviewed. They should have an obvious, clear privacy policies, clear explanation of the authors and the sponsors, people behind it, et cetera. But we also find that even on the networks that I work on, like Diabetic Connect, which is this very large kind of Facebook-like site specifically for diabetes, they're very self-policing. And what they also did is recruited some of the top advocates, the people who are most active on there, to be moderators. But it's kind of amazing how quickly people get shouted down if they say stupid stuff. And the internet is just a reflection of the world, right? Out in the world, there's going to be good information, there's going to be bad information. I used to tell people, you walk up to a newsstand, and you can tell the difference between the New York Times and the National Enquirer because there are some really obvious clues, right? So that's where it starts. But there are other ways to vet that information. And I think that, a lot of times on our site, if one person posts something silly, we'll get more comments in response to that than we would have gotten on the article itself. The 12 people will say, oh my God, you've got to be kidding me, right? And we leave all those up because we want people to see that, you know, that the community clearly knows that that's wrong. So, but I mean, we're also there. We always have disclaimers. We're not trying to give anybody a diagnosis or to tell them specifically. We get a lot of questions. We do a very fun kind of Q&A called Ask to Mine on Saturdays. And I think it's unlike any other disease Q&A out there. It's a guy who's a community diabetes educator in rural New Mexico. He sees lots of mostly type 2 patients, but also type 1. And it's kind of modeled after the Wired magazine, you know, Ask Mr. What is it? Ask Mr. Smart, Ask Mr. Knowledgeable. I forget his name. But where it's like you have quirky questions about navigating life. And for us, it's navigating life with diabetes. And all these questions have come in, you know, just everything from, you know, trying to have sex with an insulin pump to, you know, what happens during menopause, or, you know, people ask a lot about different treatments, and we can talk about them in general terms, but we would never tell someone how they should titrate their dose or something. Absolutely not. And a lot of our, part of the answer to the question is, here's what you need to know about this. And by the way, if you want to do something about this for yourself, you really need to consult an actual healthcare professional, you know, your own doctor. So it's really less of a you know, scary world out there than you would think.
Yeah. Is that your experience too, other panelists?
I agree a lot with what Amy's saying. I think that coming from the, you know, utility camp, which is we've been about utility and technology, I feel like there's a huge amount of appetite from the end user's perspective for authoritative content, because they've got access now to data. They've got access to information, and they've been able to collect it, and they know more about themselves. But I think the big opportunity now is having this narrator, right? This guide, this coach, this motivator, however you want to characterize it, to inform them now. Like, okay, I have all this information. What do I do? Like, how do I make smart choices? How do I make the next decision? So I think the role of content is even more valuable, but I think it just needs to, I think the mechanics of it have to be a little bit different. I think syndication is super important. You know, so the traditional media model is, you know, put a bunch of content on a website and try to draw people in. But I think there's so many more opportunities for vehicles to bring this content to the point, again, the right time, right moment, right audience, to the point of engagement. You know, like in our world, that point of engagement, like I said, is pre-post, during activities, those kinds of things. But I think content is key still, and I think the marriage of the two, utility empowers, content informs, that creates, to me, the best holistic experience for the consumer, patient, client, whatever it is.
We take a fairly broad-based view of content. So our platform started really as a consumer kind of content play, with the idea that we would get content contributed by nationally recognized organizations and brands with full attribution to put that content on the site. So over 150 orgs, American Diabetes Association, American Cancer Society, all of those types of folks. .govs. Lygea's on there.
That's how we met.
That's right. As well as about 30,000 other experts who are clinical or fitness related or other types of experts that put their content on the site in a variety of different forms. Some is in video, some is in kind of editorial article kind of stuff, and a lot of it is in Q&A format, where somebody might ask a question and they might get 4 or 5 responses to the same question. This is how Johns Hopkins answers it. This is how different experts might answer it. For us, it's less about, and I completely agree with you, Amy, that we have a community site called Daily Strength. Same thing. I mean, it is. We don't allow it to be completely self-policing, but
there's
those
still
folks
moderation,
but they are very vested in making sure, and it is a relatively self-governing kind of world in that aspect. But there are in the clinical world, as you get to more of the clinical topics, there are some different approaches, all evidence-based, that people might want to see a variety of different answers to these questions. And again, our view is with full attribution to who those people are and the clinical citation to where it's coming from. And we do complete medical review of all of our content on an ongoing basis. And it's sometimes difficult to manage some of the more fringy sides of alternative medicine to make sure that the claims that are being made are actually able to be substantiated so that people don't get misinformation. But putting that out and putting it in the consumer's hands to be able to see some of those different perspectives can be valuable in that sense.
So we've got about 20 minutes, and I'd love to open the floor, see if folks have questions of their own that they'd like to bring on up. Do we? I don't. Go ahead. I don't know. Do we have a roving mic or not? We don't. Okay, so speak loud. Awesome. So if you could, yeah, give your name and maybe what organization you're with, if any, and.
My name is Elisa Rivera, and I'm a freelance content producer, but I've worked for Caltech, UCLA School of Medicine, so I've been playing in this area for a long time. Two questions. I just wanted to ask about the series East Los High and how that may have changed things in terms of narrative storytelling, speaking directly to what you were talking about. And I also have a second question. The boomers are aging and they're engaging more with the healthcare system and will continue to do so probably for the next 20 years. And how does that change the landscape for communicators and how we engage those people and their children as they move to the healthcare system?
I'll answer East Los High. East
Do you want to
Lo-
repeat the question
Yeah.
just in case folks didn't know?
First one was, what about this program that started out very low budget, East Los High, but it has very sort of sexy storylines about a high school, East Los Angeles High School, and it's Los Angeles anyway. It's got very interesting, sexy content. So it became very popular. It's become like this juggernaut kind of on its own, but it includes accurate healthcare information. And I'll give a shout out to my colleagues at Annenberg. Also has at the Norman Lear Center, we have a Hollywood Health and Society, which is funded by the CDC. And this is they actually do a lot of outreach to various shows. They've been working with them for quite a while to make sure that the information in the storylines is accurate, one. And so that's been great because this is an audience that was very hard to reach, right? It was younger, it was Latino, it was just not being reached by any other primetime shows that we were working with. So that has changed things. And even though we do work with Univision and Telemundo, this was not an audience we were getting even there. So one. And the second part was,
Do you see more content like this being produced in the future, or?
I think the success of East Los High has been a real revelation. I think there will be more. And again, it wasn't high budget. It's still not high budget as far as I know, but it's quite gripping content. And I think there's going to be more things that are self-produced. My concern is that things will be self-produced and will not sort of have the same standards of at least trying to be accurate. I do some work with the government on HPV, human papillomavirus vaccination, and some of the myths and misinformation on that topic is just, rampant. So the second part of the question was, again?
That now that the boomers are
The boomers,
older and they're entering the healthcare system, how is that going to change health communication and engagement?
Someone, you want to take that?
Yeah, I'll weigh in a little bit on that from our perspective. So it's having a huge impact. I mean, set aside digital health, just the healthcare infrastructure is really not equipped and prepared to meet the demand that is coming, right? Just from physicians, from specialties, from all of the care that's needed. And so I think some of that is picking up the slack on better communication, education for folks to be able to kind of manage some of that. Big piece, I think you alluded to this, is around sort of the caregiving perspective. About 43.5 million Americans are caregivers right now today, and that's only going to continue to increase. They deliver about $450 billion in unpaid assistance. The value of the care that they are delivering is massive. So some of that demand is going to continue to be taken up in that caregiver. So our ability to equip caregivers with the kinds of information and tools to be able to deliver some of that is massive. We have to be able to deliver that piece of it. It's interesting. We do some interesting work with AARP, in particular around brain health. And I don't know where you come from your expectations around where that audience is in terms of digital connectedness. I tend to be more surprised at how connected they really are. Certainly not like the millennials are in terms of social media and mobile necessarily, but still very digitally connected, and it will continue to be more so as we move down the pike. And so there's going to be an interesting kind of hybrid how we can connect to those people directly, and then how we can equip the caregivers through other mediums as well. So I think it's going to play itself out in both areas. I don't know if others have a view on that.
Anybody else got questions? Okay, go ahead.
So my name is Jeanette Tapati, and I'm the author and creator of the best-selling book and DVD, The Fat Chick Works Out. And I work with people of all shapes and sizes that haven't exercised in a while or ever. And I was just wondering if you think that there's a sense in terms of people finding someone to identify with, that the sort of celebrity super slick model is changing, or is that still just going to be where we go from now on?
Is it to me?
It,
To anyone?
anyone.
Well, I think there's, unfortunately, you can see who is being represented on the media, and they're still, largely within the bottom. They've done some content analysis of body types. In fact, I've done some content analysis of body types shown on primetime television. The percentage of women that fall in the 10 percentile of body weight, right, really skinny, is overwhelming. Men are shown as being much more in the mid-range, and but it's very skewed. I would like to think that it's changing. I haven't seen a lot of evidence of that. Dove and other companies and See Jane Run, I don't know if you're familiar with the See Jane Run project, which is also run out of Vandenberg. It has been trying to change body image, but I don't know. Do you have a comment on that?
I don't have any comments as to the media's perception of the images, but I can share that within our platform, I think the largest opportunity for us, and I think the largest amount of people on our platform, 85% of them, we actually classify as a beginner to recreational type of user whose goals really are aligned with things like weight loss and which is probably no secret, but enjoyment, health, general health types of behaviors. And to me, that's a very positive sign that people are embracing working out for what, I think for the right reasons, not to place judgment on why people work out. I mean, I think it's great that everyone should be working out. But we do have an issue in the United States. We know that, as many as, or as few as, depending what you read in the media, 30% of the people are regularly active. And we would love to see that number increase. And our mission, as you said, is empowering. We use the term athletes, but I think can be interpreted as people with some sort of goal orientation. And we actually call that out, and we actually try to serve content, and we try to give tools and resources to people to help them achieve their goals, regardless of whether it's, just even, weight management because of some sort of, clinical disease that they're trying to deal with, or they're setting a PR, a marathon time. All the tools are valuable and relevant. But bringing them along that path and achieving goals, and obviously the positive cascade of things that come from feeling good about themselves. But our goal is to build the platform to 500 million people. And when you think about 137 million people, it's roughly 30% of the United States. I mean, we would love to see 50% of the United States using some form of nutrition or fitness tracking tool. So again, our broad accessibility is really what we're trying to do. And whether you're at the beginning or the end of, or wherever you are in your fitness journey, we're trying to make it relevant. So I think that we think that that's the largest opportunity, and that's a big portion of who we're trying to serve.
I guess I could jump in a little bit on that. I mean, the tricky thing in the area of diabetes, type 2 diabetes in particular, is it's the blame and shame disease, right? So everybody thinks, oh, you brought it on yourself, you're overweight. So that doesn't help in the cycle of, people trying to get more active, take better care of themselves. So, I mean, I really think it helps to have, more and more high profile spokespeople. So there are a number of celebrities that, come out and talked about their diabetes. Unfortunately, things like Paula Deen kind of backfire because, here's this person who's perpetrating the worst possible diet, but then you look at Tom Hanks coming out recently on Letterman talking about his type 2 diabetes. And what I loved there was that he said, my doctor told me to lose weight, and, it's not realistic that I'm going to fit into this tux that I wore to my high school, prom, because I was super skinny then. Like, I think high profile people who aren't necessarily in that 10%, the tiny skinny, and then being realistic about what's achievable, and not thinking that you're just going to suddenly, transform into the Jane Fonda of the 80s or something. That you just small steps, being a little bit more active, and having a more. For us, it's a combination of being active and having portion control and just a sense of what you're putting in your mouth. But I think it's just really important. The more and more sort of real people out there who are speaking up on behalf of these challenges.
We it's interesting, and I won't speak to kind of the mass media view, because the economics that drive that side of the equation dictate how a lot of those images kind of happen. But if you look at how real behavior change happens in the area of like fitness and activity and those kinds of things, there's some interesting work that, Dr. Mike Roizen, who's the chief wellness officer at Cleveland Clinic, he just came out with a book called Your Do-Over, something related to do-over. A concept in there is buddies, that people achieve much higher level of consistency, engagement, and improvement when they connect with a buddy. And we've helped him to create a system to kind of match people to a buddy that will be effective. And a buddy that will be effective for you in terms of outcomes is not necessarily your best friend or your spouse or somebody you know. And the metrics and the qualities and qualifications by which you match a buddy depends on how you personally get motivated, right? Do I want a drill sergeant? Do I want somebody who is right there alongside me in exactly the same condition I'm in, somebody who's been where I am but now has improved? It's different for almost each one of us. And so the ability to understand that difference and align with the right kind of role model, as it were, to help you achieve that, I think is really interesting and important. And that's an interesting approach that I think, again, I don't know that you'll see that played out in the mass media kind of world of how that happens. But I think when you really get down to the ground level of how stuff happens and how it changes and how people get motivated, I think that's really important.
Sorry, really quick. I think that's absolutely true. The mentoring and having a buddy.
Yeah.
And I just want to say a great example of that is a company called Omada Health, which has done this program for mainly pre-diabetes. They're moving into type 2, where they create these sort of teams. So people have an online area where they can connect with their team, but there's also an offline component to it where you buddy up with someone and you work on your exercise challenges and your food challenges, and it's working incredibly well.
Yeah, I mean, to add on to Amy and Russ's comments, I completely agree. We've found that in our own platform. We have a product called the Activity Feed, and we launched it really at the beginning of this year. And it started out sort of humbly, but as it started to gain traction, the idea behind the Activity Feed is you could actually view what your friends are doing, and it gave you the option or opportunity to post comments to their workout. And it just would, and of course, it was all in the spirit of motivation and encouragement. And it's just grown exponentially. And so the last I checked, we had something like 15,000 friend requests going out each day, and it's scaling now to 25, 30, 40, 50,000. But it supports the notion that, yeah, friends help support people in their health and fitness endeavors. And we're now adding functionality in terms of like posting pictures and it goes back to narrative too. I think people get excited when you can kind of share the story of, hey, look at me after my workout. I'm exhausted and I look like crap, but I feel great. And I'm celebrating, and my friends are giving me thumbs up and high fives. And, and there's a sense of like, sort of like this passive type of, guilt and shame are not the effective mechanisms for getting people to work out. But I think it's more of a sense of like, hey, I want to be a part of this because I see my friends doing it. So it's been an effective tool for us from a social engagement standpoint. But I agree with everything here. And absolutely. And then I think the other piece Amy touched upon is something that we've launched in our UA Record product, which is the ability to have peer-to-peer challenges. So something is simple. It's like really about helping to encourage each other to change behavior. Something as simple as, hey, make sure you drink, 8 6-ounce glasses of water a day. And then you can see when one person logged it. So, it's the, you've probably heard gamifying and making it fun or whatever you want to call it. But yeah, friends are needed.
Any other questions? We've got one right here in the front. Yep.
Hi, my name is Michelle Frizell, and I'm Shelly and her puppet pals. Kind of laugh about it because I think this just seems like a random thing. I feel like a little kid in the room, but that's because I work with kids, and it's kids' health and fitness. And I was just wondering if you see anything on any of the platforms that has to do with educating our youngest before it becomes a problem that we're undoing. I mean, I think actually there's a big business in undoing the problem we created so like 5840, and not that I'm there, right? But you know what I'm saying? There's a big business in that, but right now I'm developing something that's, you know, for kids fitness, and it's educational entertainment, so it's just fun. It's little webisodes and, you know, little snacky things like that. But is there any movement to really make a, you know, any kind of education? I know juvenile diabetes does some, and that's something that I've got to, something that I can think about participating in, but do you see anything more?
The name of it is escaping me, but the National Diabetes Education Program, NDEP, did this program a couple years ago. Literally, it was like a TV series where they featured different kids in, like, you know, East LA, different places, and then sort of were helping work with them to do kind of a makeover of their lifestyle. But obviously what they realized is you cannot just target kids, because it's all about what's going on in their family, right? They emulate their parents, and if their parents aren't helping them get to where they need to go to do the exercise, they can't do it. So it was like sort of like an intervention program with the whole family, and with really good results. And then they were showing these videos at schools around the country. And so that's one effort that I think has a lot of promise. I'm not sure exactly where it's going, but it really is a family thing with kids. That's the thing.
Arguably with adults too. However you define your family, you know. Any other questions out there? We're getting close to the end, but please.
I have a program on Pasadena cable station called the Travel Food and Fitness Network, and we empower our audience on fitness and food and different healthy ways to embrace a healthy lifestyle. And I'm curious, I know Doug mentioned the phone app. I'm curious if you guys are embracing the social media change with Instagram, Facebook, Twitter, and really reaching out and empowering the audience for the family.
Yeah, I mean, absolutely. I think, as I mentioned, with the ability to the individual to curate that experience beyond, you know, here's my workout, point A to point B. We've done customized Instagram hashtags. We're doing integration of like music playlists. We're doing able to you know, share videos, those types of things, which really is the complete experience, the complete story. I think that you'll also find down the road people that are traveling having curated fitness experiences. So being able to like download some sort of a podcast, you need to have a guide. We do like audio encouragement too. So we obviously work with a lot of advertisers. So we give them the ability to connect with the users while they're running. You know, hey, fantastic, great job. We do things with rewarding, so loyalty and rewards programs. So one thing I didn't touch upon is that through our technology, we actually have open APIs and SDKs that allows third parties to receive data from the end user through an authentication layer, and that can power rewards. It basically takes exercise and creates currency out of it. So we power rewards programs for folks like Walgreens. We did a campaign with a Live Positively campaign with Coca-Cola, where it was just it was a community service type of thing, and they wanted to give people the opportunity to vote for their favorite public parks. So you could actually, there was 3 voting mechanisms. The first was like a Facebook like, you got 1 point. Second was a Foursquare check-in, you get 5 points. But the third was logged verified activity, you got 10 points. So we're trying to, again, it's all about trying to get people in the spirit of making fitness fun, and giving them a sense of, hey, I'm getting something of value for what I'm already doing, and it's some sort of it's like a surprise and delight mechanism and encouragement. So those are just some of the ideas, some of the things we're doing. Yeah.
Thank you. I imagine others may have questions, but I think we need to wrap up. So please join me in thanking this amazing group of panelists for the discussion. And feel free to come on up and talk to people if you have some one-on-one questions. Oh, sure.